Joining us now, practicing physician scientist and healthcare administrator, Dr. Vivian Lee. She is president of Health Platforms at Verily and a senior lecturer at Harvard Medical School. She's also the author of the new book entitled The Long Fix, Solving America's Healthcare Crisis with Strategies that Work for Everyone. It's very good to have you on the show. Thanks for being on. A lot to talk about. I want to get to your plans and concepts to try and work through this. But just looking at the numbers here in terms of healthcare, losing 1.4 million workers in April, the impact on the healthcare sector, and also what has become of these people?
Such a great question, and it's so great to be with you this morning. Thank you for having me. One of the things that the COVID crisis is really teaching us is that we have to build a much more robust and resilient healthcare system. The fact that our healthcare system right now is designed to be fee-for-service means that we've invested in things that generate fees, like operating rooms and imaging centers and cancer centers. And as soon as we stop having the ability to generate those fees, like in a COVID crisis, we're laying off, as you said, over 1.4 million doctors and nurses. And we know we actually have a critical shortage of doctors and nurses because of our aging population. And as we were just hearing about, we're all concerned about all the people who didn't receive care over these last few months who need care, plus the concerns about a resurgence of COVID in the next few months. Clearly, we need to think about how can we build a more resilient system. And one of the things that I write about in this book, The Long Fix, is about how we can do that, how we can change the way in which we pay our hospitals, pay our physicians, so that we can create a system that's not only more resilient, but also more ready in the face of these kinds of crises.
Dr. Lee, it's Willie Geist. Good to have you on this morning. You do look at the big picture of our healthcare system very well. You do it in your book and as part of your profession. So what would you say? We're certainly not in after-action report time yet. We're in the middle of this crisis. But as you look at it from 30,000 feet, what would you say we need to be prepared for the next time this kind of thing comes up, if God forbid it does? How can we do better than we've done this time?
Well, you know, there are already plans that have been put into place. This is not the first pandemic or epidemic that our country has faced. We know that under President Bush, for example, who was very concerned about a repeat of the 1918 influenza epidemic and set into motion a whole planning process. We know the Obama administration had to deal with Ebola and Zika, dusted off some old plans, also started to put those into place. Those plans talk about PPE. They talk about social distancing. It's not like these ideas are necessarily new. We just didn't have the political will to follow them through and to fund them. So we absolutely need to invest in public health and prevention. We also need to completely rethink how we're paying for healthcare. This fee-for-service model means that hospitals and doctors are living hand to mouth, and we're only investing in things that generate fees and not things that can actually help prevent pandemics and help us really respond. You know, there are some really fantastic examples of where we are doing it right. So in Medicare, there's a program called Medicare Advantage. About a third of all seniors are in Medicare Advantage. And many of the clinics that I write about actually in the book, ChenMed, Iora Health, many of these groups now are paid in a completely different way. They get paid a fixed amount of money every year to care for people, and they can take those dollars now with the security of knowing that they have them up front and invest in much better care. They actually invest in on-site pharmacies, in shuttles for their patients to come in, be brought into clinic and back. They actually, during this COVID crisis, because they weren't worried about furloughing their employees like most hospitals, they've actually set up urgent care in their clinics. When their elders are afraid of going to these scary emergency rooms in a COVID crisis, they can go to the clinic and be cared for safely there. And as a result, they're kept healthy, they're kept out of the hospital, and in the long run, they actually save us money. So I think there are many ways in which we can actually prepare ourselves. There just needs to be the will to get us there, the political will to get us there.
The new book is The Long Fix: Solving America's Healthcare Crisis with Strategies That Work for Everyone. Harvard Medical School's Dr. Vivian Lee, thank you very much. And coming up, it was a tale of two very different styles of leadership. President Trump and Joe Biden both made public appearances this Memorial Day, one with a mask and one without. And Gene Robinson says the president gave the pandemic an indelible visual image this weekend. Trump declared it was essential that Americans be able to spend Sunday at church services, but he chose to head for the links himself instead. Morning Joe will be right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.